Stacey. Welcome to Matt Chats episode 2. Thank you very much for coming on.
Hi.
What was it, Stacey? Sorry, no problem. I always say it's a pleasure that people want to come on and share the story and just you know it's inspiring. What was it that made you want to come on, Stacey?
I think it's just like when you have your own struggles, you kind of feel like alone. I don't think there's enough of this out there at the moment. I don't think there's enough talk. Like, everybody's quite big on mental health, but I don't think people really do enough to support it and know what to do and how to react to it. Whereas I'm a firm believer as in we should make it as a priority, just like as physical health. As mental health should just be like as physical health. It should be a normal topic. People should be able to speak freely about it, and most importantly, not feel alone.
Totally agree. I think that was probably part of why I wanted to do this, because I feel that we have I spoke about it previously, that we have a little bit of a culture, I think, where we just feel really uncomfortable talking about how we feel. And I mean, particularly in this country, I think we're quite polite, aren't we, as a nation generally? So, you know, when somebody says, "How are you today? You all right?" Yeah, not so bad. Even if I'm feeling absolutely dreadful, just you like an automatic response is, "Yeah, I'm all right. I'm all right." Why? Why? Yeah, a little bit like that. Yeah. Why are we like? Why is it like that? Why do you think we? It's like we're conditioned to respond like that. We just yeah, I'm not so bad. When really we might be feeling absolutely dreadful, but we don't feel able to. Whereas if it were physical, we would say, "Oh God, yeah, I were in an accident last week, or I broke my ankle last Thursday at football," or it just feels really different talking about mental health rather than talking about your physical health. Am I making sense? And I don't understand it.
No, I completely agree. I feel like it's almost a taboo subject. You kind of feel like when people share that they're not really sure on how they'll be perceived, if you get me. I kind of feel like people often think, oh, well, if I say this, people are going to judge me automatically.
Do you think that perception might be?
Yeah.
What do you think it might be, though, from other people? You know, that perception, you say...
It's just stigma, isn't it? Like, obviously, growing up and things like that, it's, you know, especially when I was growing up and at school, there weren't really much about mental health. There were pretty much nothing. So obviously you're inheriting everything that your parents have been through as well, and then you've no real outlet and no real where to go and no where to talk about it. Like, it's not an open subject. Like, you know, we've come a long way now with PHSE classes and things like that. But back when I were at school, there were nothing like it. You do it, you know, maybe if you started talking about how you felt mentally, it was automatic. Oh, you need to be in a nut house. You need some happy pills, and that's how it went. And it was a stigma that surrounded it. So people automatically judged you on how you felt mentally, rather than saying, "Are you all right, mate? Like, I know how you're feeling," or anything like that. Because if you twist your ankle, you get a million people saying to you, "Oh, well, when I twisted my ankle, we did this." And I think that's how mental health should be as well. I feel like if you speak about your mental health, it should just be a topic that you're comfortable with speaking about. Everybody should just be on the same page. Everybody should just be quite like, "Oh, well, when I felt a bit low, I felt like doing this, or I did this, or I wanted to do this, and this kind of brought me out of it." Because I think if you start off small, I think that's the main thing with mental health. If I'd started speaking about how I felt before I got bad, I wouldn't have been half as bad as what I was, but I felt like I'd be judged, and I kept everything caged up and kept it inside me. It's kind of like a root, isn't it? Once it starts growing, it can spiral and grow out of control. And I think that's basically like mental health in a nutshell, and people talking about it. It should be a more open topic. It should be a more open forum.
You stole my train of thought there. I was going to say something really similar about, like you say, if you twist your ankle or break your ankle, maybe there'd be a prescription. There'd be a prescribed response, should we say? So it'd be, okay, we need to do X, Y, and Z. That's your treatment, and people are quite comfortable with that. Whereas, like you said, in regards to mental health, I think there's still a little bit of maybe a panic. Maybe people worry about, how do I respond to this? What should I do in this situation? Obviously, we probably come in at it from a different perspective, because obviously I work in mental health and I've got personal experience. You've got personal experience, and we've worked. Full disclosure, myself and Stacey worked together. Didn't we? We had the same role. We worked within a service where we would work with people with probably undiagnosed mental health difficulties. A lot of people that we worked with at that time. Quite a stressful role, wasn't it? I suppose we come at it from a perspective where we know a little bit about it, I suppose, don't we?
Yeah, 100%. I mean, as well, like there's that perspective, and then there's personal perspective as well. Like, I think the more people see it from different avenues and start taking on like what role they can play in people's mental health, I think it can only make the world a little bit of a better place, rather than just having one train of thought of, oh well, get yourself to doctors, get some happy pills, as people used to say. It's not about that anymore. It's not. It's genuinely not. Like, obviously my past experiences and things like that, I was in a really bad place, and what helped me more than anything were talking. I think, talking to people, talking to therapists, friends, anybody that you feel comfortable talking to. I think if you have a lifeline like that, it can make the world a difference to you. And like, just going back to when you said the motivation of what brought me on here today, I kind of feel like if I can just get out to one person, that if it's all right, if all you did today were get out of bed and just breathe and take it easy, then that's an amazing task in itself when you're feeling crap.
Totally agree. Let's go back. Let's look back to that. I mentioned we worked together, and we've probably not spoke for. It's been a long time, hasn't it? Actually, since we saw each other, spoke.
9 years, 10 years,
something like that. So if we go back to maybe around that time, or in fact go back as far as you want. Actually, Stacey, I don't know how far you want to go back, but so when did you realise maybe that your mental health weren't where you wanted it to be?
I think ultimately, like, I had a massive tragedy. My mum, brother, and sister, like, and they died basically. It was awful. I weren't. So we're talking like maybe 8 years ago. So if you go back 8 years, like my whole world crumbled. I then had to. I don't know. I can't even describe what at that time I felt like I had to do. I remember sitting there thinking, oh, I've got to be strong. I've got to do this. I've got to do that. Everything was really regimented. I had it in my head how I wanted things to go and what I wanted to do and things, but I never really stopped. And I think that was the spiraling point. Like, I should have stopped, and I should have listened to myself. I should have listened to how I was feeling. And I just kept it all bottled up. And like previously when I said it's like a root, it massively is, because had I give myself time to grieve, it probably wouldn't have lasted 9 years, because I've been in therapy now for 2 years near enough, and it's made the world a difference. But the journey to get to the point where I was ready for therapy was not a very pleasant journey. Most days I didn't want to get out of bed. I didn't want to do anything. I wanted to sit. I wanted to cry. And that weren't just the grief. Like, I kind of put it down to, oh, this is just me missing people. But there were a massive element that weren't. And I think as well at the time, people also put it down to, oh, she's just a little bit sad. She's lost her mum. She's lost a lot. And I don't think many people really checked in mentally at that time. From no fault of their own. Like, that's just past experiences with them, not really knowing how to deal with it. Probably me being typical British stiff upper lip. I'm all right, try to battle on. And then I think I remember getting to a point of thinking I'm just sad all the time. I'm just miserable. Like, I don't know what to do with myself. I don't know how to act. I don't know how to be. I don't know who to be. And it were almost like I was looking at myself from the outside, not really recognising the person that I'd become. During this time, I'd put on a ridiculous amount of weight because I were unhappy. My life had just completely spiraled. Like, I genuinely didn't know what to do, who I was becoming, what was going to happen to me, why I felt the way that I felt. There were so many questions, and like, I think I can only describe it as I felt like I had so many people around me, and I was standing in the middle of a crowded room screaming at the top of my lungs, but nobody could hear me. I kind of just felt like I was drowned. And then I got to a point probably like 2 years ago, 18 months, 2 years ago, and I just thought enough's enough now. Enough's enough. Complete breaking point. Like, we're either going to go two ways. I were either not wanting to be here anymore, or I needed to get help. And I remember just being sat crying, thinking, like, people are just going to think I'm a nutter. People are just going to think I'm insane. Like, the amount of thoughts that went through my head were almost enough for me to just think, well, I don't want to be here anymore. Like, I'd go the other way. But admitting to myself and saying it out loud, like, I've got something the matter with me, well, probably the hardest thing that I've ever had to do in my life. And then I went to the doctors, spoke to the doctors about it. At first, it wasn't very good, if I'm honest with you. It's kind of like we're kind of stuck in a cycle as well, with the NHS. There seems to be a lot of people wanting to help with mental health situations, but then there's not a lot of services to fulfill the help that's needed for people. And that's obviously, there's no fault of the NHS at all. They're stretched as is. And then coming off the back of COVID, it were a bit of a difficult time for me to be able to get the help that I needed to get. But since being on my journey of going to the doctors, prescribing anti-anxiety medication, getting the help that I needed, and actually getting a therapist what I could talk to, I'd probably say that saved my life. I genuinely do think that, credit to them where credit's due. I just wish that they weren't as spread so thin, because when you're in a bad place and you're reaching out, for you to have a 3-month waiting list on top of that, it could end in a completely different scenario, in a completely different situation.
Definitely. I'd like to come back to that if we can. I want to go back to when you mentioned there were a couple of things that I thought were really pertinent, maybe three. So you mentioned bottling things up.
Yeah.
Yeah. You mentioned that you felt like you were in a crowded room, sort of screaming at the top of your lungs. So I wanted to maybe ask you what would have been helpful from perspective of maybe the other people around you. What would have been helpful at that time for you from them? And then you mentioned about eating and wondered what purpose that filled, or whether like a link between eating and your mood. So if you just start with sort of bottling it up, and what made you feel as though you needed to bottle everything up and sort of muddle on at
I
that
don't know.
time?
I kind of feel like it's the stigma again. I had, like, don't get me wrong, I had some fantastic people around me that, probably would have listened and wouldn't have judged, given the chance, if I'd have only opened up. But the more I bottled it up, the more it became a me problem. It were almost as if I were fighting against myself. It were like when you shake a bottle of Sprite and you open the lid and it goes everywhere. That's kind of the scenario that I was in. The more I bottled up, the more I didn't want to talk about it, the more I wanted to push it under the carpet, the more I wanted to forget about it. Went out for meals just to try and it were all pretend, basically. Everything everything were a pretense. I were going through the motions of things and just not dealing with things in the way that I needed to deal with them.
Just trying to put a brave face on day to day.
Yeah, yeah, that's it.
Yeah.
Just and almost as well, not wanting to burden people. And I think that was the main point for me. Like, you know, I've always been a strong character. You know, always been a strong character. I've always, you know, laughing and joking, life and soul of a party. You know, that were me. Lost so much of myself during the 8-year period that I didn't really recognise me anyway. And then I just thought, well, I can't. You know, I've got to keep this pretense up. People think that I'm all right if I pretend I'm all right.
Scared?
You what, sorry?
Were you scared? And I mean that in respect of being scared of what you felt that you had become, so to that difference in personality, presentation, and scared to.
Yeah, I was scared to feel. Yeah. I was scared to feel. I kind of, because of the bottling up part, I kind of felt like the minute I opened the floodgates, I knew what were going to happen. Obviously, the background that we've had working together before gave me the insight knowledge to know that, you know, I'm probably going to experience some massive surge in feelings, and you know, you've got to deal with your trauma, you've got to deal with grief, you've got to deal with, you know, quite a lot of things that you are supposed to deal with and not bottle them up. But you kind of get to a point where, yeah, fear is a massive part in it. You know, I remember going to the doctors thinking, no, they're going to commit me. I'm going to be carted off in a straight jacket and put in some kind of institution somewhere where I'm not going to be able to do anything. And that was the complete opposite. But that's how, when you're in that kind of mindset, you perceive things.
So what would have been useful, sort of from perspective of the people that were around you? What would have been useful at that time from them to you?
I think it's just recognizing signs. I think it's just recognizing signs. Like, a lot of people obviously knew that I weren't all right. And a lot of people knew that I weren't doing well. But, you know, I always link it to, like, on Facebook when it's your birthday, you have 1 million people, everybody, you know, everybody on your Facebook posts happy birthday, even if you've met them once. I kind of feel like that's what it's like. Like, everybody wants to know if you're all right, and they want the yeah, I'm all right answer, rather than the no, I'm not all right. Whereas there's only so many people that you feel like you can trust, and there's only so many people where you feel like you want to divulge that information to, because you don't know how they're going to take it, and you don't know if they're strong enough to take it. So it's another thing where you're thinking about other people rather than yourself.
You were worried, you know, like you mentioned burden, didn't you? So you were worried if I actually tell somebody what's going on here and how I'm feeling, how are they going to respond? You know, I'm not comfortable with potentially upsetting somebody, upsetting a friend. Is that the kind of, is that what you mean?
Yeah, upsetting my friend, upsetting my wife, upsetting, you know, my kids. It were a lot. It genuinely was.
Mm-hmm.
Having to have a brave face as well, like not wanting to really show anything, because end of the day I had 2 kids and a wife that I also had to make sure they were all right.
And then we come back to this sort of, I think we mentioned it earlier about this show of strength. Like we've been conditioned to believe that not speaking and keeping things bottled up is a show of strength. I don't think that's true. This is another reason why I'm doing what I'm doing, because I think the show of strength is you coming on here and talking about these sorts of things. I think that takes real strength. I think it takes real strength to go to doctors and say, I can't go on like this. I need to make some changes. Speaking to whoever it might be, a professional. That's where the strength is for me. But I think as a society, we like I said, we almost conditioned to think that the strength, be strong, sort of pull your socks up sort of thing is being quiet and introvert about things that are going on in thoughts and feelings. I think we need to get rid of that, don't we? I think that there's a it's about time in 2024 that we I think we are slowly but surely. I think we're getting better, but we're not anywhere near for me. I think we're still a way off, aren't we? I think.
But I mean, we're a lot off the mark compared. I can't even speak today. Compared to other places, but I think as well it boils down to a government funding thing, doesn't it? If the funding's not there, then people can't do the job. And if people can't do the job, then the people that need their help can't get the help. It becomes a vicious cycle.
I agree. You mentioned as well that it brought me. I was thinking about it. I'm half putting words in your mouth here, but you mentioned about eating, didn't you? And what I was going to ask, I was going to ask the question, or it made me think to ask a question of whether you had developed unhelpful coping strategies at that time as well. And I don't know if that's what that was.
Massively. I had to make myself feel moderately better. So I'd be going out and having meals every other day just because I like the meals. And I didn't want to do anything in the house. I didn't want to cook. I wanted to eat crap constantly. I got up to like, I think it was 24 stone. And then like when I decided to start therapy, I decided to start the gym as well. Because I thought if I'm gonna feel good, I've got to feel good everywhere. I've got to get that different dopamine hit from somewhere else. So I started off at the gym, hated it, hated it with a passion. First few months were awful, but kept pushing myself. Yeah, it's consistency. I genuinely think like in your mind, you need that. You need the consistency. You need the accountability. You need to do the things that aren't necessarily really easy, but make you feel a little bit better.
Let's just fast forward then. So you mentioned 9 years. So we had 9 years before we felt able to speak to a GP. You went to GP, is that right?
Yeah. Yeah.
What about that day?
What, when I went to the GP? So it was like an accumulation of days, if I'm honest with you. I remember being sat and I just cried. Couldn't get off the floor. Couldn't do anything. Just cried. And I was just like, I need help. I need help. I can't live like this. I need something. Something needs to happen. Like, I'm really sad. Spoke to my wife. She wasn't judgmental at all. She wasn't what I thought she was going to be the whole time. So we booked an appointment to go to the doctors. Couldn't get an emergency, which was really bizarre. Couldn't get an emergency and mental health appointment over the phone with the GP himself. So I had to have, he's like a nurse practitioner lady. Went in, spoke to her. She was absolutely amazing. She was. Now I'm in this position that I'm in now, where I feel really good, and I'm in a much better place. I kind of think, why didn't I do it sooner? Why was I that scared? Why did I have that big build up of anxiety to just go and get help? Because she sat and bless her, she cleared quite a lot of patients so that she could sit, and because she was like, you're on a roll, I don't want you to leave, like we're here to talk to you, and we'll try and do his best.
Can I ask you what it was about that nurse that was so good? I think you've answered my question. I think that just purely the fact that she gave you the time and space that you needed.
There was nothing forced. It weren't like, you've got your 10-minute slot, that's it, you're in and out, you've got to be in and out. I think that's what made me think, what, she's bothered about how I feel. She wants to know. And then once I'd instantly told her, and once I started feeling like that, I instantly thought, well, maybe I can get better. It was a really quick shift, if I'm honest with you. It was like really, really quick for me. So kind of bottled it up for so long, went to the doctors, and then I was like, after speaking, oh well, maybe this can work for me. Maybe I can. And I remember walking out of the doctors, obviously, 'cause when you have like a mental health assessment thing, they kind of like you in on your own. And I walked out, and I just said to my wife, like, look, it's probably not going to be easy, this by any means, but you know, I've talked it through, and we've got a plan, and stuck to the plan basically.
Like you sort of you took that lid off, didn't you? And as soon as you took that lid off and but done it in a sort of like a healthier way, that was started your journey, wasn't it? You sort of gone, ah, God,
The pressure cooker, the lid was gone, and
9 years of holding it, and then we've gone, you know, I'll unload some of that and I'll give it to you. It's called transference. So that transference then from your pocket into a therapist's pocket, or on that occasion it was a nurse's pocket sort of thing, for that nurse to deal with. That's been absolutely massive for you, hasn't it? There's no doubt.
it saved my life. You just had to get to that point.
Yeah.
I mean, it was difficult, but
do you think that first step is the most difficult step?
it's awful. It is. It's not a nice place to feel, when you feel like, I don't know, you kind of stuck between wanting help and thinking that you'll be all right as you are. But then as well, when you get the help, you kind of, I don't know. I'm kind of sad, because I lost so many years of my life by not opening up earlier. But then you can't think on the what ifs, like, because I could have gone another 15 years. Do you know what I mean? So I guess whenever the right time is, well, the right time.
One of my favourite quotes is, "Post adversity comes greatness." And I always think, when we've experienced a difficult period of time, and I don't think it needs to be I don't think there needs to be sort of like a time on that, but when we've gone through such a difficult period of time, when we come out of that other side, I think we really appreciate where it is that we've got to, because we've experienced that adversity. I think it sounds really poignant as well for yourself, Stacey. It sounds like where we are now. So in fact, we'll come to that. So your process started with a nursing associate. You think it was a nursing associate?
Yeah, it's like a nursing associate at the practice.
And then what's sort of next step?
Then I had to wait quite a considerable amount of time, but I was massively struggling with anxiety and everything like that. So she put me on anti-anxiety medication. Obviously, the anti-anxiety medication, you know, I can't say that I'm a fan of it, because it does what it's designed to do. You don't feel the symptoms. You don't feel the symptoms of anxiety.
Okay.
But you still feel the mental side of anxiety. It doesn't take away the panic. It just takes away the fact that you're going to have a panic attack.
Right.
It stops the tingling and stuff, and
stops the physical,
breathing.
the physical stuff.
Yeah, it stops the physical stuff. It don't take away the mental. So I had that, and then
what's the name of it? Remind me.
Begins with P. Propofol or something like that.
Propanol.
That's it.
That's it. Yeah.
So then I'm very lucky. At my GP surgery, they had a mental health nurse who came into the practice once a month. So I managed to get an appointment with her. This was just until my therapist first appointment, which was a telephone appointment. That came probably 5-6 weeks after my first stepping foot into the doctors. Then they assess you for different levels of therapy, to see whether it's like kind of like is it CBT pathway, or maybe more.
There's like sort of Yeah, so you'd have an initial assessment, and then they consider whether you need enhanced or core therapy, or even maybe specialist therapy.
Yeah, so I had to have specialist therapy, and then it's like it moved pretty quickly because got diagnosed with PTSD.
Okay.
And then that kind of made the thoughts and feelings and everything feel normal, like because it was as if like your brain plays tricks on you a little bit when you've got PTSD. It kind of like triggers you and re-triggers your memories. So I had the desensitization therapy with the eyes. That
Yeah.
worked wonders. And a whole load of talking, if I'm honest with you. Like, you know, the desensitization therapy was so far at the end. To get to that point, I had to really open up and open some wounds and almost go back. You have to go back and relearn everything about yourself and relearn who you are and to put you in
Same
the best.
therapist.
You what? Sorry.
Well, same therapist. It sounds like you've had EMDR, eye movement desensitization reprocessing. Is that right?
Yeah.
Yeah. But we've also had more traditional therapy alongside.
Yeah.
Sort of like a trauma informed. It sounds like a trauma informed intervention. Were it the same therapist?
No, it were two different ones.
What was that like, having to go to two different therapists?
The first one I kept because I'd built the relationship up. So that she was the first one that I saw. And she initially referred me for PTSD treatment, basically. So I kept her all along. Still, you know, she's still there now for phone calls and stuff like that. Checks in with me and things, which is really nice. The PTSD therapy was that's like a course. They take you right back and re-trigger you, basically. They trigger everything that would cause the stress of PTSD to flare up. They put you in a position where that is how you need to get over it. So yeah, you've got to be in a position where you're ready to go back before you can move forward.
And that might take some time, like you say. So your talking therapy, you trauma informed therapy, you've done first. You've done all that sort of talking and revisiting things, and then you've had your EMDR when you're in a more best way to put it, in a
better
position to be able to
headspace.
go back and
That's what it basically is. It gets you ready to, you know, you're in a better frame of mind. You're in a better headspace. All of the other little things that you'd let get on top of you because of the big thing that you actually need to deal with, they're easy to manage. They're easier to process, and you can concentrate on. It's like a filing cabinet, isn't it? Your mind's like a filing cabinet. You open a drawer at a time. If you start opening loads of drawers at different times, it's going to be a mess again, and it's going to be scrambled.
I say that a lot at work. I'll say, let's just deal with one thing at a time. And we'll get to that, but let's deal with one thing at a time. I think there's probably a little bit of impatience, isn't there, sometimes? And I think we do it as well as professionals. We can be a little bit impatient. We want to see results really quick, don't we? We want to get to that point. We want to get to the next point. It's a process, isn't it? It's definitely a process. So how long were you actually in therapy for?
Like I said, the talking woman, she's still there now. We're checking all the time. The PTSD, roughly 7-8 months from start to finish. Obviously, you have to get your kind of diagnosis before that, where you'll do like it's almost like an assessment. They'll have you and they'll talk to you, and then all the panels meet and they see if you've got PTSD. It's really bizarre to think of it that way, that people meet to say that you have or you haven't got something mentally wrong with you, and then they decide the best course of action, because the desensitization therapy isn't always the best course of action for everyone with PTSD. But yeah, probably like 7-8 months of that. And then they I kept calling them Nanny McPhee because they were there when I needed them, and then they disappear. Like it's mad. Like you use them, and they get you to a point where they say that you can cope, and then they go, and then they've gone, and then they just leave you alone. And yeah, it's a weird one. Like they just vanished. It's as if, almost as if your brain's playing tricks on you, as if it's never happened. If I'm honest with you. If I didn't know any better, I'd think, oh, that was just a big joke. But no, it definitely did happen.
Were
Yeah.
you comfortable with that at the time? Were you comfortable with sort of, okay, treatment's finished. We think that you're in a position now where we can discharge you. Did you feel all right with that?
I mean, you have a chat with them before, and everything's done really. It's not rushed. The thing is, once you get into the services, it's not a rushed thing. It's not like they'll give you as long as you need. There was plenty of times where they said, how are you feeling now? Do you feel like you need more? Are you coping? How are you? A lot of homework as well with PTSD to go out and try and put yourself in situations where you're triggered, and they kind of send you out and do things that is going to basically trigger you to see if you can manage, and then how you deal with it after you've managed.
Talk
So
about your senses. So how you respond to different sensory triggers. Did it for that part of it?
yeah, there's a lot of stuff like that. Obviously, like it's for me, a lot of it were like smell, like the smell of my mum had re-trigger things. Like her favorite perfume and things. Hearing noises, as stupid as it sounds, like the PlayStation startup logo reminded me of my brother and my sister. Like cars, like it was. There were a whole load of things that had to be worked on. But yeah, it was crazy. It was a crazy experience, but one that I would recommend if if you need help. Then
That's
I
what I
would
was going to ask
suggest
you.
that.
I was going to say how effective were that therapy for you? Both sort of, you're talking and then your specific EMDR specialist intervention.
Yeah, so the talking therapy would phenomenal. Like just getting everything off your chest, and it's getting everything off your chest to someone that's completely impartial to you, and that for me made the world a difference. Because, like I said, you're scared of letting people down, or saying the wrong thing, or saying too much, or saying too little, and you might have friends that, well, how come you've told her that and you've not told me? And it's like, well, this is messing with my head now. So the lady herself, she's been phenomenal. Like she genuinely has. She's worth the weight in gold. Just listening, just non-judging, amazing. She was an amazing woman. Well, she still is. She's not left me.
That's brilliant. And you say you went to the gym, didn't you, as well? I'm really interested for you to talk a little bit about gym. And initially it weren't so good. We didn't really like it, but then something happened. Tell us about
that. So like one of the girls that we used to work with before, randomly bumped into her. She was training at the same gym, and we said, "Oh well, we'll catch up. We'll have a go at doing a workout together." And then since then, like, I just really enjoyed it. I think it was more routine that I needed. It was structure that I needed. Because like anybody that's struggled with mental health or struggles with mental health, it's not linear. There's days where I wake up and think, oh no. But I think the most important thing is knowing that you can have bad days and you can have good days, and they don't define you. Them days don't define you, and every bad day you have doesn't mean that you're going to end up in such a dark place again. It can just be a case of you've had a crap day. things have got too much. But my coping mechanism now is the gym. Like, I go to the gym, I lift heavy weights, I talk to my mate about
Your release.
everything and anything. And that's just, it gets rid of a lot. It gets rid of a lot of negative energy. It gives you good vibes as well. Like, you've got positive endorphins running through you. You've got that dopamine in it. And as well, like, I've got myself into a bit of a cycle where I'm doing it at like 5 o'clock in the morning. So I must be enjoying it now down the line to be doing it before I'm
That is dedication.
starting the day.
That's proper dedication, isn't it? 5 in the morning.
Yeah, I think it's just taking a negative thing and then making a positive thing out of it. I never thought, like, genuinely never thought, like, I've lost just over 13 stone. Just going to gym, just working out, just being
That's
a
incredible.
better version of myself, a healthier version of myself, and a better version of myself. Because, you know, if I was fixing my mind, I, like, one of the main focuses is I wanted to be all right for my kids. And if I was fixing my mind and I was 24 stone, there's no point having a cracking mind and then not being able to do anything that you've missed out on with your kids. So I needed to fix overall. So I went into, okay, I always joke and say, you know, like in the gyms, it's the new year, new me. It genuinely was the new year, new me. And it was the start of probably the biggest, hardest adventure that I've been on. But I'm so glad that it happened. I'm so glad that I got the help that I needed, because, you know, like I said, there's days where you're sad. You know, I think for the rest of my life, I'll probably feel sad about, you know, not having my mum, not having my brother, not having my sister. I don't think there's ever going to be a point where I'm just all right with that. I don't think for 1 second. But I think working through everything and knowing that you can have an element of sadness and an element of grief and missing people, but you can also have your life. And I think if you've got your life and you've got good people around you, life can be whatever you make it, can't it?
Just going to say, in fact, a couple of things I wanted to finish on. We've got 10 minutes because my subscription to this this sort of what do you call them, platform. I only get hour meetings. I could go on all day. Honestly, I could talk to you all night. It's fascinating. I'm going to ask you to your journey with Jim. How long will that process? So obviously, you've lost a hell of a lot of weight there, haven't you? You've lost a near like a me.
Yeah. It's like 2 years, 2 years, solid work, like four gym sessions a week, then a bit of cardio. There are a lot. You know, done quite a lot. Also got a personal trainer. Got into it that much now. I'm spending more money at the gym, which is crazy because, you know, I thought I was spending a lot of money eating out and unhealthy. Like, try buying pre-workout to get up at 5:30 in the morning to go to the gym with your grips and everything that you need to buy to lift properly and things. It's a crazy habit, but yeah, it's probably 4 or 5 sessions a week. Then just eating healthy. Just it's been better. Like I said, just been a better version of me.
How do
More
you feel?
authentic.
I was just going to say. I was just going to say sort of how the difference from then to now. Can you sum it up in a sentence or a couple of sentences? What that difference is for you? What it's done for you?
Saved me. There's no other way around it. It has saved me, and the mental clarity that I have now is phenomenal. Like, I'm so in touch with how I am mentally that, you know, I just hope that everybody that struggles could possibly get to the level that I feel now, because if I'd have gone back 2 years when I broke completely, I would have never thought that this would have been possible.
Stacey, like I said, I could talk to you all day, all night. Thank you very much for coming on. How were it? How were it for you? Were it all right? Did it go all right?
Yeah.
Yeah. Like I said, I'm really appreciate you coming on, and I think that people will be able to get something from that. I think there'll be a lot of people that hopefully anyway, a lot of people that watch that and think and will be inspired and see that, you know, through even the darkest of times, that there can be a way through. I think you're real evidence of that, and I doff my cap to your journey. I think you really are an inspiration, and like I said, I can't thank you enough. Thank you very much for coming on.
No problem. Anytime, mate.
It was lovely to catch up anyway. We'll have to, like I said to my previous guest, I'd love to get guests back on to sort of talk about like an update really. How you getting on, what you've been up to, etc. So I'll definitely, I'd love to keep in touch and just see see how you're getting on with things.
Yeah, you've got my email. Drop me an email.
I do. Fantastic. Thank you very much.
All right.
I just want to say a massive thank you to Stacey for coming on the channel and talking so openly about trauma and loss and PTSD, and then your journey, your journey into therapy, and how that saved your life, in your own words, and using the gym as a positive coping strategy. I think that'll be really inspirational to people that are going to watch that video. Thank you very much. I will be eternally grateful for everybody that comes on the channel. You're all inspirational. You inspire me, and I hope that that people that watch will be inspired to reach out and seek that support. I'm sure that there'll be a lot of people that will be able to empathise with your journey, Stacey, and get a lot from that. So thank you very much. So that was episode 2, which will be released in December, mid-December. Then we have a recording on Saturday this week and Sunday this week. So that's episodes for January and February that are booked in. What I've decided to do is I've decided to release one video per month, one guest video per month. But in between that, what I'm going to do is I'm going to release clips or shorts of the treatment modalities that I've found particularly useful in my own journey, and maybe what my patients have found most useful as well. So keep your eyes peeled for those, and we'll see you very soon. Thanks for watching. Please make sure that you like and subscribe. Take care, everybody.